Personalized medicine. Personalized medicine is personal. We are all different. Some of our difference translate into how we react to drugs as individuals. This is why personalized medicine is important to everyone. Why does someone need twist the standard test to be effective? Why does this drug work for you but don't me? Why do I have side effect and you don't? Why do some people get cancer and other don't? Why is anecdotal information relevant to you, your own health and treatment? If it were not for the great variability among individual, medicine might well be a science, not an art. The goal of personalized medicine, the right dose of, the right drug for, the right indication for, the right patient at the right time, pharmacogenetics and pharmacogenomics. Pharmacogenetics, the role of genetics in drug response. Pharmacogenomics, the science that allows us to predict a response to drug based on an individual genetic makeup. Pharmacogenetics and pharmacogenomics. Pharmacogenetics, a study of individual gene drug interactions, are usually one of two genes that have dominant effect on a drug response. Pharmacogenomics, a study of genomic influence on drug response, often using high throughput data sequencing, SNP chip expression, proteomics, complex interactions. A case study in pharmacogenetics used to treat lymphoblastic leukemia, autoimmune disease, inflammatory bowel disease after transplant, interferes with nucleic acid synthesis, therapeutic indexes limited by immunosuppression, metabolism of 6-MP. Pharmacogenetic, a case study. Second example, codeine and cytochrome P450 CYP2 6. Cytochrome oxidase P450 enzymes, 54 different active genes, 17 different families. CYP1, CYP2, and CYP3 are primarily involved in drug metabolism. Effect of metabolic rate on drug doses. Warfarin significant problems for humans. Rank 1 is total mentions of death for drug causing adverse event. Rank among the top drug associated hospital emergency room visit for bleeding. Overall frequency of major bleeding range from 2% to 16%. Minor bleeding event rates in randomized controlled trials of new anticoagulants has been as high as 29 per year. Warfarin significant problems for humans. Case report July 2, 2008. Company director died of brain hemorrhage after hitting a football. Consult neurosurgeon told the inquest the warfarin effect was probably the cause of the death. It was happen to anyone. Other warfarin patient case report July 2, 2008. Joseph Stevlin. Why maintaining warfarin therapeutic range in critical? Finding dose to maintain therapeutic anticoagulation is largely trial and error. Warfarin level depend on two enzymes CYP2C9, ORC1 estimated warfarin dose based on genotype, frequency of VKORC1 alleles in various populations. Genetic analysis permits more rapid determination of stable therapeutic dose, better prediction of dose than clinical methods alone, applicable to the 70 to 75% of patients not in controlled anticoagulation centers, reduce between 4,500 and 22,000 seriously bleeding events annually. Genetic testing now required by FDA. Another anticoagulant, clopidogrel and CYP2C919 alleles. Drug response. What are targeted drugs? Often drugs are only effective in specific subpopulations. Yearly identification of responders can have a dramatic effect on treatment success. Treatment of non-responder but put these individuals at unnecessary risk of adverse event while providing an benefit. Personalized medicine allows the identification of responder and non-responders for targeted therapies. This is happening today. Mm, Trastuzumab in a normal breast tissue cell, the HER2 gene is expressing cell surface receptor required for normal cell growth. In certain type of breast cancer, the HER2 gene in overexpressing the cell surface receptor contributing to consensus cell growth is the case in 30% of breast cancer. Herceptin is an antibody that blocks the cell surface receptor and hereby prevents further growth. As a result, disease progression is slowed down. Personalized drug. FDA requires genetic tests for certain therapies. Roche chip for cytochrome P450 gene CYPC19 and CYP2D6. AMA course on pharmacogenomics and personalized medicine.